Hi, welcome to podcast number 3. In this podcast, we're going to attention PFAS in the home and go over things that have got PFAS in them and how you can reduce your PFAS exposures. And our subtopic today is to look at medical errors in the healthcare system. How significant is it? So we'll be covering that secondly. Let's get going. Okay, protecting your family from PFAS, a practical guide to understanding, testing, and reducing exposure. Imagine chemicals so persistent they've been found in the Arctic ice, rainwater worldwide, and the bloodstream of nearly every person tested in the developed countries. These aren't exotic substances confined to industrial sites. They're in your kitchen, cookware, your child's waterproof jacket, the takeaway container from last night's dinner, and quite possibly your drinking water. Welcome to the world of PFAS, per- and polyfluoroalkyl substances, more ominously known as forever chemicals. The nickname isn't these human-made chemicals don't break down in the environment or in our bodies, building up over the years and potentially affecting our health in ways scientists are still working to fully understand. Children are especially vulnerable because of their developing bodies. They absorb these substances more readily, and exposure during critical growth periods can affect immune system development, hormone regulation, and even vaccine effectiveness. Once in the body, these chemicals build up over time rather than breaking down naturally. The health risks are significant and well known. PFAS exposure has been associated with higher cholesterol levels, liver damage, thyroid issues, reduced fertility, and an increased risk of cancer, especially kidney and testicular cancers. Expectant mothers face extra concerns as PFAS can cross the placental barrier and show up in breast milk, potentially impacting fetal development and birth weights. If this sounds alarming, it should, but it shouldn't paralyze you. While PFAS contamination is widespread, families aren't powerless. Understanding where these chemicals hide, how they enter our bodies, whether testing is worthwhile for your situation, and practical steps to reduce exposure can make a real difference in your family's long-term health. This guide explains what you need to know: sources of PFAS exposure in everyday life, how to measure the body burden, what testing involves and when it's worthwhile, and proven strategies to reduce your family's exposure and possibly lower existing contamination. PFAS are a family of thousands of synthetic chemicals developed since the 80s for their exceptional properties. They repel water, withstand heat, and do not break down easily. These same properties that make them useful also make them hazardous. They persist indefinitely in the environment and accumulate in living organisms, including us. The Centers for Disease Control and Prevention estimates that PFAS are detectable in the blood of about 97 to 99% of Americans. This almost universal contamination occurs because these chemicals are found in a wide range of products and through various exposure routes. For most people, drinking water is the primary source of PFAS exposure, especially in contaminated communities. PFAS enters the water supplies through various pathways: industrial discharge from manufacturing facilities, leaching from landfills with PFAS-treated products, contamination from firefighting foam used at airports and military bases, and runoff from agricultural land treated with PFAS pesticides or biosolids containing PFAS. The US EPA's 2024 National Primary Drinking Water Regulation establishes maximum contaminant levels for 6 PFAS compounds, but water systems have until 2031 to meet these standards. Until then, millions of Americans continue drinking contaminated water. An NRDC interactive map released in 2025 shows that water systems in most US states have been contaminated with PFAS. High concentrations of PFAS have been detected across Australia, with many sites exceeding recommended drinking water levels, especially in areas where firefighting foams were previously used, such as military bases and fire training facilities. Friends of the Earth Australia has compiled a database of around 450 detections of PFAS chemicals in drinking water supplies across the country. The highest levels of contamination have been found near defence bases, airports, and areas where PFAS-containing firefighting foams were historically used. In June 2025, Australia revised its drinking water guidelines with lower limits for PFAS. The new guideline levels are PFOS 8 nanograms per litre, PFOA 200, PFHXS 30, PFBS 1000, but these cover only 4 PFAS chemicals. There are thousands of PFAS chemicals. This topic will be explored further in the next podcast article with regard to how these drinking water levels were decided on. PFAS enter our diets through various pathways. Food packaging is a major source. Greaseproof paper, fast food wrappers, microwave popcorn bags, pizza boxes, and confectionery wrappers often contain PFAS. When hot, greasy, or acidic foods come into contact with these materials, PFAS transfers into the food. Beyond packaging, PFAS contaminate the actual food supply. Fish and seafood accumulate PFAS from contaminated waters, with wild-caught fish often showing higher levels than farmed varieties. Grown in PFAS-contaminated soil or irrigated with contaminated water and sprayed with PFAS-containing pesticides absorb these chemicals. Livestock raised near contaminated sites or fed contaminated feed show elevated PFAS levels. The European Food Safety Authority identified fish, meat, fruit and fruit products, eggs and egg products as a major PFAS contributors. A 2024 FDA analysis tested over 1,900 food samples and found PFAS in various products, though the agency maintains levels are generally low. However, the FDA tests for only a fraction of the thousands of PFAS compounds, and cumulative exposure from multiple foods isn't yet well understood or considered. PFAS are present in many household items, often without consumers realising. In the kitchen, non-stick cookware coated with Teflon or similar materials release PFAS, especially when scratched or heated beyond recommended temperatures. Some stainless steel cookware with non-stick features also contain PFAS. In living spaces, stain-resistant treatments on carpets, upholstery, and other fabrics often contain PFAS. Water-resistant or stain-repellent furniture, bedding, and textiles treated for these qualities are likely to contain these chemicals. Cleaning products, paints, varnishes, and sealants may also include PFAS. Personal care products offer another way of exposure. Certain cosmetics, especially long-wearing makeup like waterproof mascara and liquid lipsticks, contain PFAS. Dental floss, shampoos, and nail polish have all tested positive for these chemicals. 10 US states have enacted laws specifically addressing PFAS in personal care items. Outdoor and sporting gear is a major category of PFAS-containing products. Waterproof jackets, rain gear, and outdoor clothing often use PFAS treatments. Ski wax, camping gear, and athletic wear frequently contain these chemicals. A 2025 PMC study found especially high PFAS levels in masks, anti-fogging sprays, and cloth products, raising concerns about exposure. Certain jobs are associated with higher PFAS exposures. Firefighters have particularly high exposure from aqueous film-forming foams used during training and firefighting, as well as from PFAS in their protective gear. Workers in fluorochemical manufacturing, semiconductor production, chrome plating and commercial aviation also face occupational safety exposures. Living close to certain sites significantly raises exposure. Military bases, airports where firefighting foam was used, as mentioned before, fluorochemical manufacturing facilities, landfills, wastewater treatment plants, and agricultural areas treated with contaminated biosolids. House dust acts as both a reservoir and a delivery pathway for PFAS. Chemicals from carpets, furniture treatments, and consumer products build up in dust. Young children who crawl on the floor and often put objects in their mouth are particularly exposed to this. Indoor sources such as consumer products and treated upholstery are the main contributors to PFAS in household dust. Given this widespread contamination, many families wonder how much PFAS do we actually have in our bodies? Should we get tested? What would the results be? Biomonitoring measures chemicals directly in human tissues and finds combining all exposure sources and pathways into a single indicator of internal exposure or body burden. For PFAS, blood serum has been the main biomonitoring medium because many PFAS tend to accumulate there due to their affinity for serum proteins. The CDC's National Health and Nutrition Examination Survey has monitored PFAS levels in blood serum for years, establishing national reference ranges. This data from 2015 to 16 showed detectable levels of multiple PFAS compounds in most tested individuals, although levels of legacy PFAS like PFOA and PFOS have decreased since these chemicals were phased out of consumer products in the early 2000s. Unfortunately, newer PFAS chemicals have taken their place, and exposure to these alternatives is more difficult to assess because they are not being monitored or tested for. PFAS blood testing offers a snapshot of your body burden at the time of sample collection. It indicates exposures from the past several years, as PFAS have elimination half-life ranging from months to years depending on the specific chemical. However, testing has significant limitations. Blood tests don't reveal the source of your exposure, whether from water, food, dust, or products. It can't forecast your future health outcomes. Having elevated PFAS levels doesn't mean you'll develop health problems, just as low levels don't guarantee you won't. Someone with low levels today may have had higher levels in the past that have since decreased. Traditional serum testing involves a blood draw by a phlebotomist with the sample sent to a specialised laboratory. CDC reports on 16 PFAS compounds. Commercial laboratories like Eurofins offer analysis of 45 or more. That's in the States. Newer self-collection techniques using volumetric absorption microsamples enable individuals to gather capillary blood through a finger prick at home. Research indicates that PFAS levels in these self-collected samples align closely with those in traditional venous serum samples. Companies such as Eurofins and Quest Diagnostics in the States now offer at-home PFAS testing kits, though these can be costly, ranging from $200 to $600, depending on the number of PFAS compounds that are to be tested. For those who can't access or afford testing, the CDC provides a PFAS blood level estimation tool. This online calculator offers personalised estimates of PFAS blood levels based on drinking water exposure data you input, although it doesn't match the accuracy of actual testing. The National Academies of Sciences 2022 guidance recommends clinicians offer PFAS testing to patients who are likely to have a history of elevated exposure. Those with occupational exposure to PFAS, firefighters, fluorochemical workers, people who have lived in communities with drinking water contaminated above health advisory levels, individuals living near known contamination sites, the military bases, airports and manufacturing facilities and landfills, and people concerned about exposure seeking a baseline measurement. For most families without known high exposure, routine PFAS testing isn't currently advised. The results rarely influence clinical decisions since there are no specific medical treatments for PFAS exposure. Testing is most useful when it can guide choices, such as whether to fit water filters, participate in compensation schemes related to contamination, or create a baseline for monitoring changes over time. Women who have been pregnant, breastfeeding, or menstruated regularly often show lower PFAS levels than men of similar age and exposure. This isn't because they're less exposed, it's because PFAS are transferred to infants during pregnancy and breastfeeding and lost through menstrual blood. While this may lower a woman's level, it means the next generation starts life with PFAS contamination inherited from their mothers. The good news, families can take practical steps to cut ongoing PFAS exposure and potentially lower their existing body burdens. While you can't eliminate all PFAS exposure in modern life, you can significantly reduce it. If contamination is detected, certain filtration methods are effective. Reverse osmosis systems remove PFAS very efficiently. Granular activated carbon filters reduce PFAS, but they must be replaced regularly once saturated. Nanofiltration also eliminates PFAS. Standard pitcher filters vary significantly in effectiveness. Look for NSF certification specifically for PFAS removal. For severe contamination, distillation offers another method, boiling water and collecting the steam while leaving the contaminants behind. Replace non-stick cookware with alternatives such as stainless steel, ceramic or glass. If you must use non-stick pans, never heat them empty. Avoid high temperatures, discard them when they're scratched, and don't use metal utensils that can scratch the surface. Avoid using grease-resistant food packaging. This involves steering clear of microwave popcorn bags, fast food wrappers, pizza boxes, and other treated paper products whenever possible. Opt for fresh foods instead of packaged ones. Cook from scratch more regularly and use your own containers for takeaways wherever possible. Store food in glass, stainless steel, or silicone containers instead of treated paper or plastic. Avoid compostable food surfaceware, which often contains PFAS despite its green marking. Since dust gathers PFAS from household products, reducing dust is important. Use a vacuum with a HEPA filter to catch fine particles. Wet mop hard floors instead of dry sweeping, which lifts up dust. Clean often, especially if you have young children who play on the floors. When buying new furniture, carpets or textiles, avoid products labelled as stain resistant, water repellent, or treated for stain or water resistance. These treatments are likely to contain PFAS. Look for PFAS-free certificates or check the manufacturer websites. If you already own treated furniture or carpets, you can't remove the PFAS, but you can reduce ongoing exposure by thorough vacuuming and cleaning. Avoid cosmetics labelled as long-lasting, waterproof or wear-resistant. These qualities often derive from PFAS. Consult sources such as the Green Science Policy Institute's PFAS Central, which provides lists of PFAS-free cosmetics, clothing and other products. Choose dental floss that doesn't contain PFAS. If it's easy to pull through the teeth, then it is lubricated with PFAS. Check shampoo and personal care product labels, although ingredient lists often don't specify or disclose PFAS. Replace waterproof or water-resistant clothing, especially for items that don't genuinely need these features. For outdoor gear where water resistance is important, look for PFAS-free options. Brands like Patagonia and others are committed to phasing out PFAS. The Green Science Policy Institute keeps up an updated list of PFAS-free outdoor gear and clothing brands. Wash new clothes before wearing, as this removes some surface treatments. Be aware that clothing marketed as wrinkle-free or stain-resistant likely contain PFAS treatments. Furthermore, fire retardant materials such as pajamas, bedding, through to lounge chairs and the like can sometimes be infused with PFAS chemicals. While the body slowly eliminates PFAS, emerging research suggests ways to potentially improve removal. Increased dietary fiber. Multiple studies show links between higher dietary fiber intake and lower PFAS levels. A 2024 pilot study found that oat beta-glucan is a soluble fiber supplement PFAS body burdens in mice by disrupting intrahepatic recirculation, which allows PFAS to be reabsorbed rather than excreted. Consuming fiber-rich foods, fruits, vegetables, whole grains, legumes, oats, may help reduce PFAS levels over time. Probiotics show promising potential. Certain lactobacillus strains can bind PFAS in the digestive system, possibly lowering absorption and reabsorption. Eating probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi supports gut health and may help eliminate PFAS. Cholesterol management is important. PFAS binds to proteins involved in lipid transport, so interventions that lower cholesterol, including dietary changes, exercise, and weight loss, may also reduce PFAS levels. A Swedish study found that cholestyramine, a medication used to lower cholesterol, significantly sped up PFAS elimination from the body. While cholestyramine needs medical supervision, natural methods to lower cholesterol might offer similar benefits. Blood donation is the most well-documented way to reduce PFAS levels. A 52-week study of Australian firefighters found that regular blood and plasma donations significantly reduced PFAS body burdens. While you shouldn't donate solely for this reason, if you're eligible to donate blood, it adds an extra incentive to do so regularly. Sweating through exercise and sauna may help eliminate PFAS, although research remains limited. Some PFAS can be excreted by sweat, so regular exercise and infrared sauna sessions might aid elimination, but this should not be relied upon as a primary method. Children are particularly vulnerable to PFAS for several reasons. Their developing systems are more sensitive to chemical exposure. They have lower body weights, meaning the same exposure results in a higher dose per kilogram. They spend more time on the floor and put objects in their mouths. This increases with dust exposure. And they have longer remaining lifetime exposure windows. Breastfeeding mothers should be aware that PFAS can be passed through breast milk. However, the scientific consensus remains that the advantages of breastfeeding significantly outweigh the risks associated with PFAS exposures. Mothers worried about this should aim to reduce ongoing PFAS exposures rather than avoid breastfeeding. For infant formula, use PFAS-filtered water. For toddlers and children, avoid PFAS-treated products like stain-resistant clothing. Choose PFAS-free school supplies and vacuum and clean regularly to minimize dust exposure. While individual actions matter, family-level interventions can only go so far when contamination is this widespread. Effective protection requires systemic changes, stricter regulations on PFAS in consumer products. Many states are moving in this direction in the US. Cleaning up contaminated water sources, restricting PFAS use in food packaging and cookware, improved labelling so consumers know what they're purchasing, and investing in PFAS-free alternatives. The reality of PFAS contamination can feel overwhelming. These chemicals are literally everywhere: our blood, water, food, and homes. We didn't choose this exposure, and even with full awareness, we can't avoid it completely. But perfectionism is the enemy of progress. You don't need to eliminate every source of PFAS exposure to make a difference. Start with the high-impact changes. Filter your water if it's contaminated. Replace non-stick cookware. Avoid grease-resistant food packaging. Vacuum with a HEPA filter. And choose PFAS-free products when replacing the items you already need. Small changes add up. A family that filters their water, switches their cookware, avoids packaged foods, and cleans regularly with a HEPA vacuum will significantly reduce their PFAS exposure compared to a family that does none of these things. Furthermore, the science of PFAS removal is progressing. Fiber supplements, probiotics, cholesterol control, and other methods show potential to reduce body burdens, not just prevent new exposures. What we discover in the coming years may create new options for families to actively cut their PFAS contamination. Your family's health is worth the effort. Every step you take to reduce exposure, every product you choose more carefully, and every small change in your daily routine, these all matter. They are important for your health today and for the health of your children in the future. PFAS may be forever chemicals in the environment, but they don't have to remain forever at current levels in your family. With awareness, vigilance, and consistent effort, you can stand against this invisible threat and create a healthier future for those that you care about. Here are some helpful resources listed. If you want to go through them, then halt this playback on this podcast. I'll move on. This is a summary of what we've been talking about. I won't go through them again. Again, it's just a summary. And this is your action plan. Check if your water is contaminated. Local authority website. Identify highest risk items in your home. That's what you could do today. This week, research water filter options if you need it. Start reducing packaged foods. Begin using glass or stainless steel containers. This month, you could replace non-stick cookware when feasible. Increase fiber intake, like oats, vegetables, whole grains. Start HEPA vacuum routine. And ongoing, you could choose PFAS-free when replacing household items. Maintain awareness when shopping, and consider blood donation, which helps you and others. So your family's health matters, and I've already outlined these points. Now let's cover the subtopic for today: medical errors and standard practices, which are a persistent crisis in healthcare. For decades, healthcare systems in developed nations have grappled with a troubling reality. The very institutions designed to heal are also significant sources of harm and death. While medical advances continue at a remarkable pace, the toll from medical errors and questionable standard practices remains staggeringly high in both the United States and Australia, raising fundamental questions about the safety and efficacy of conventional medicine. In 2016, Johns Hopkins patient safety researchers calculated that more than 250,000 Americans die annually from medical errors, positioning it as the third leading cause of death in the US, behind only heart disease and cancer. This figure has remained remarkably consistent over the years, suggesting that despite increased awareness, little meaningful progress has been made in addressing the root causes of preventable harm. The National Institutes of Health updated their assessment in 2022, indicating the death toll could reach as high as 440,000 annually, though the true number may even be higher due to underreporting. The World Health Organization reported that unsafe medical care results in approximately 2.6 million deaths worldwide each year, with at least 250,000 occurring in the US alone. Australia faces a similarly sobering reality. The Australian Commission on Safety and Quality in Healthcare estimated that adverse events occurring in approximately 10% of hospital admissions, with about 50% of these being preventable. Research published in the Medical Journal of Australia found that adverse events contribute to approximately 18,000 deaths annually in Australian hospitals. When considering the broader healthcare system beyond hospitals, some estimates suggest preventable harm may contribute up to 30,000 Australian deaths per year. These aren't merely statistical anomalies, they represent real people who entered hospitals seeking healing and never returned home. The scope encompasses everything from medication errors and surgical mistakes to hospital-acquired infections and misdiagnoses. To understand the magnitude of the medical error crisis, it is helpful to compare these figures with other leading causes of death in both countries. In the United States, heart disease has approximately 297,000 deaths, cancer, as you can see, then medical errors, COVID-19, accidents, stroke, chronic lower respiratory diseases. In Australia, as you can see, cancer, then heart disease, dementia, including Alzheimer's, cerebrovascular disease, that is stroke, and medical errors preventable harm, 18 to 30,000 deaths, depending on the scope. These comparisons reveal that medical errors consistently rank among the top 3 or 4 causes of death in both countries. Using conservative estimates, medical errors claim more lives annually than strokes, respiratory diseases, diabetes, and most individual cancers. This positioning has remained remarkably stable over the decades, indicating a systemic crisis rather than a temporary problem. The recognition that modern medicine can be deadly isn't new. In 1998, University of Toronto researchers determined that properly prescribed and correctly administered pharmaceutical drugs were the 4th leading cause of death in the US, claiming between 76,000 and 137,000 lives annually. 2 years later, the Institute of Medicine reported that avoidable medical errors killed between 44,000 and 98,000 Americans each year. A comprehensive 2003 analysis titled Death by Medicine went further, calculating nearly 784,000 annual deaths from iatrogenic causes, deaths resulting from medical treatment itself. This figure included adverse drug reactions, preventable errors, hospital-acquired infections, complications from unnecessary procedures, and surgical mishaps. In Australia, the landmark Quality in Australian Healthcare study, published in 1995, found that 16.6% of hospital admissions were associated with an adverse event, with 51% of these considered preventable. This groundbreaking study was one of the first to systematically examine the prevalence of medical errors in Australian healthcare and help catalyse patient safety initiatives. Medical errors occur at multiple points in the care process. In the United States, medication-related mistakes represent a significant portion, with an estimated 450,000 preventable medication-related adverse events occurring annually. These errors can happen when medications are ordered, transcribed, dispensed, or administered. Common drug-related errors include incorrect dosages leading to overdoses, prescribing the wrong medication, dispensing errors, and accidents during surgical procedures. Australian data mirrors these concerns, Medication errors are estimated to occur in 2 to 3% of medication orders in Australian hospitals, with approximately 230,000 hospital admissions annually involving a medication-related problem. The Grattan Institute reported that medication errors cost the Australian healthcare system approximately $1.4 billion annually. Older adults face particularly high risk in both countries, with omission and improper dosing being the most frequent errors affecting this population. The complexity of managing multiple medications and age-related physiological changes makes elderly patients especially vulnerable to medication mishaps. Beyond medication errors, patients face risks from unnecessary procedures, misdiagnoses, surgical complications, and hospital-acquired infections. The Office of Inspector General for the US Department of Health and Human Services found in 2018 that 25% of Medicare patients experienced harm during their hospital stay. In Australia, healthcare-associated infections affect approximately 165,000 patients annually, contributing to around 1,800 deaths, and those figures were from 2018. One particularly striking phenomena documented in the United States is the July effect, where medical errors spike noticeably in teaching hospitals each July when new medical residents begin their training. This pattern underscores a fundamental vulnerability in healthcare systems. The combination of inexperienced, high-pressure environments and complex patient needs creates conditions ripe for mistakes. While Australia uses different training rotation schedules, similar vulnerabilities exist during transition periods when junior doctors change positions or new graduates enter the workforce. Research has shown increased mortality rates associated with these transition periods in Australian hospitals. The problem extends beyond accidental errors to include systemic issues driven by financial incentives. A 2000 investigation revealed that 30 cents of every healthcare dollar was wasted on unnecessary services, inefficient care delivery, excessive administrative costs, inflated prices, prevention failures, and fraud. By 2019, this waste had increased by $10 billion to $185 billion annually, accounting for roughly 1/4 of all healthcare spending. In Australia, the Grattan Institute estimated that approximately 25% of healthcare spending, around $10 billion annually, is wasted on low-value care that provides little or no benefit to patients. This includes unnecessary tests, procedures, and treatments driven by defensive medical practices, fee-for-service incentives, and patient demand. Healthcare journalist Shannon Brownlee documented in Overtreated Why Too Much Medicine is Making Us Sicker and Poorer that as much as 1/3 of medical care does nothing to improve health outcomes. Patients often receive tests and treatments based on their physician's specialty or the hospital's financial interests rather than genuine medical necessity. Perhaps the most troubling is that despite high healthcare expenditure, both countries face quality challenges. The US spends more on healthcare than any other nation, 18% of GDP as of 2019. Yet the Commonwealth Fund's 2021 international comparison placed the US dead last among 11 developed countries. Australia fares better in international comparisons, typically ranking in the middle of developed nations, yet still faces significant quality and safety challenges. Despite universal healthcare coverage through Medicare, Australians experience preventable harm at rates comparable to other developed nations, suggesting that access alone doesn't guarantee safety. The persistence of medical errors and harmful standard practices over decades in both the US and Australia indicates that awareness alone isn't sufficient to drive meaningful change. Systematic reforms are needed in how healthcare is delivered, how errors are reported, and analysed how financial incentives shape clinical decisions, and how patients are protected from preventable harm. For individuals, this reality underscores the importance of prevention through healthy lifestyle choices and the value of having patient advocates present during hospital stays. When medical care is necessary, seeking practitioners who address root causes rather than simply managing symptoms and who are willing to explore evidence-based alternatives may offer safer pathways to healing. The data is clear. Medical errors represent one of the leading causes of death in both America and Australia, claiming hundreds of thousands of lives annually. Until healthcare systems address the structural, financial, and cultural factors enabling this ongoing crisis, patients must remain vigilant partners in their own care. So those figures in that presentation were based on mostly pre-COVID studies. Of course, COVID came along, and then we had this amazing situation with our medical system and healthcare system just going off the rails. For example, this paper on myocarditis after SARS-CoV-2 infection. Young men less than 40 were 6 times likely to develop myocarditis. And the VAERS data from the US showed reports 223 times higher following vaccination than the combined average for all the other vaccines over the past 30 years, reflecting a 2,500% increase. And from May 21 to November 24, 90% of case reports, 241 out of 267 on PubMed, identified mRNA vaccination, not the SARS-CoV-2 infection, as the likely cause of myocarditis. An interesting summary was given by Nicholas Holscher from the McCulloch Foundation, as in 17 ways mRNA injections caused or can cause cancer. And this is based on over 100 studies produced in peer-reviewed journals. And just going down just quickly, genome instability, immune escape, impaired DNA repair mechanisms, chronic inflammation, dysregulation of the immune system, RNA disruption, activation of oncogenic pathways, tumor microenvironmental alteration, awakening dormant cancers, alteration of immune surveillance, frame shift errors, aberrant protein translation, multiple injections causing immune exhaustion, DNA contamination of Pfizer and Moderna vaccinations, oncogenic SV40 DNA sequences in Pfizer injections, dysregulation of the renin-angiotensin system, RAS, destruction of the microbiota, loss of bifidobacteria, increased resistance of cancer cells to treatment. And of course, we had various comparisons. This one here is from Japan, analysing 350 Japanese volunteers under the banner of United Citizens for Stopping mRNA Vaccines, just dropped a mind-blowing 21 million vaccination records, all obtained via Freedom of Information Act requests. So according to this, if you stayed unjabbed, your risk of dropping dead remained, shockingly, exactly the same. Not slightly higher, not dangerously higher, just normal. So, of course, we've got the figures from 2000 to 2024 here, and this was amazingly produced by the very conservative ABC Four Corners. So just going down here, the rates of increase of these various cancers: prostate, 500%, pancreatic, 200, colorectal, 173, liver, 150, thyroid, 140, uterine, 138, kidney, 85, cervical, 44, testicular, 35, breast, 24%. Then we have various papers showing evidence for new onset adverse events and cancers post-vaccination. These papers are now numerous, unfortunately. Then we have still the pharmaceutical companies fighting back with their influence through journals. This is an example where a paper was submitted based on good research, but it, of course, came up with the wrong answers. It was very negative to mRNA vaccines. So this paper was withdrawn without any real reason from the journal and wasn't published. We've got also papers talking about the genomic integration and the molecular dysregulation in stage 4 bladder cancer following COVID mRNA vaccinations, many papers of this type. And here we have another paper of many where the CDC study itself finds that COVID shots increase the risk of maternal and fetal death by 24%. 24% increase. Then we have a major study involving 1.7 million children finding that heart damage only appeared in children who had received mRNA vaccines. Not a single unvaccinated child in the group suffered from heart-related problems. In addition, the researchers note 0 children from the entire group, vaccinated or unvaccinated, died of COVID. Furthermore, the study found that COVID shots offered the children very little protection from the virus, with many becoming infected after just 14 to 15 weeks of receiving an injection. These 1.7 million children observed in the study were between the ages of 5 to 15 years old. Okay, well, that's it for this podcast. I hope you found it informative and helpful. I'll see you again next time. Thank you. Bye. The information in this podcast is provided for informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease. Information on this podcast must be discussed with your healthcare provider. Don Want disclaims any responsibility for any adverse effect from the use of the podcast information. Guest opinions are their own, and the podcast does not endorse or accept responsibility for the statements made by guests.